Okay, we got everybody ready to go? We're set. Welcome all, let's get started. Good morning, I'm Assemblymember Freddie Rodriguez, and it's my privilege this morning to introduce Assembly Bill 263, the EMS Workers' Bill of Rights. Before I begin, I want to take a moment and thank those who are able to join us today. This bill would not be possible without the hard work of the people that are here with me today. Today, over 10,000 EMS workers across the state don't have adequate rest and meal breaks. They don't have adequate protection or training against workplace violence, putting themselves in harm's way on a daily basis. These private sector EMTs don't have limited access to mental health care and are higher risk of post-traumatic stress syndrome, depression, and suicide. That is not only sad and regrettable, but is also preventable. AB263 recognizes that for too long, private sector EMTs and paramedics have been forgotten. That stops today. As many of you know, I'm not only a member of the State Assembly, but also I have been an emergency medical technician for over 30 years and continue to take shifts. I know what it's like to eat meals on your lap and in a rush. I know what it's like to have a hard day and not know where to turn. That is why I'm thrilled to be joined this morning by researchers of the UC Berkeley and UCLA Labor Research Centers. At this time, I want to invite Ken and Seba up to the podium to speak about their research in this area. Ken, Seba.
Thank you. My name's Ken Jacobs. I'm the chair of the UC Berkeley Labor Center, and this report, as mentioned, was done jointly by the labor centers at UC Berkeley and UCLA. And in the report, we examine the wages and working conditions of emergency medical service workers in California. We provide an overview of the industry and governance structures and recommend policies to improve work and service outcomes in this fast-growing sector. I'll discuss our results in wages and working conditions and then pass it over to Saba Wahid from UCLA. Emergency medical technicians and paramedics are the backbone of California's emergency medical service system. Their wages and working conditions, however, do not match the important role this fast-growing industry plays in healthcare delivery in our state. We estimate there are about 17,000 EMS workers in the state, not including firefighters. 80% of those are employed by private EMS providers and 20% directly by public agencies. Wages for private sector EMS workers are low and stagnating. Private sector jobs lag well behind their public sector counterparts in job quality, compensation, and opportunities for career advancement. Just to give you a sense of this, in 2014, the hourly median wage for private sector EMS workers in the state was $16.49 an hour. That compares to $27 an hour for the public sector EMS workers. Adjusted for inflation, the median wage for private sector EMS workers actually fell 12% between 2007 and 2013. More than a third of the workers earned less than $13.63 an hour, which is a common measure for low-wage work in the state, and a quarter of the private sector EMS workers were in households with incomes below 200% of the federal poverty line. EMS workers work long hours. Most work 12 to 24-hour shifts and are only eligible to stop working due to fatigue after 15 hours. Previous studies have found that the resulting fatigue from long work hours can impact patient care, especially when long shifts are combined with high-volume workloads. One of the most taxing elements for EMS workers is the practice of posting. In the past, ambulances were stationed at fixed comfort stations, so there'd be an apartment, people could rest there. Today, it's common practice for ambulances to be posted on street corners and parking lots to await calls, which is done to reduce response times. But posting in the cramped ambulance increases the likelihood of back pain and makes it difficult for workers to take rest and meal breaks. And when employees do take rest breaks, they remain on call and have to be ready to respond if a call comes their way. So in practice, that means workers can go very long periods of time without a break or the ability to eat. And as noted in the fact sheet handed out today, the California Supreme Court recent decision in Augustus v. ABM determined that for a break to be considered valid, employees must be relieved from work obligations. EMS work can also be dangerous with higher than average rates of mortality, injury, and mental trauma. A national study of EMS workers found that the mortality rate was only slightly lower than police officers, and they have a disproportionately high injury rates. Along with the physical demands of the job, health risks include ambulance accidents, potentially violent patients, and exposure to pathogens, and the mental stress of emergency response. A number of previous studies have found that EMTs and paramedics suffer disproportionately from post-traumatic stress disorder, depression, and suicidal ideation. These conditions have been shown to develop in individuals repeatedly exposed to traumatic events. And a recent national survey done last year of EMS workers found that 37% had contemplated suicide. That's 10 times the average for the general population. And that 6.6% had attempted suicide, which is 13 times the average for the general population. In the first 9 months of 2014, they found 58 documented suicides among EMS workers in the United States. Researchers for that study noted that the internal climate and level of support for mental health varies significantly across EMS agencies and has a real impact on suicide attempts and on mental health. So low wages, lack of career opportunities, and taxing working conditions exacerbate turnover among private providers, which has important implications for service quality. While more data is needed in this area, there's both qualitative and quantitative evidence that turnover is a problem for private EMS firms. And we know from the research in other areas that high turnover is associated with lower quality performance and worse health and safety outcomes, which affects both workers and consumers. So I'm now going to turn it over to Sabah Waheed, who will discuss changes in the industry and some of the policy recommendations. Thank you.
Thank you, Ken. And thank you, Assemblymember. So my name is Sabah Waheed. I'm the Research Director at the UCLA Labor Center. So as Ken mentioned, the data is clearly showing that private sector jobs lag well behind their public sector counterparts, both in terms of job quality, compensation, and opportunities for career advancement. Yet, the private sector is a key force in this industry. Though 78% of EMS service providers are in the public sector, private firms operate 81% of the ambulances. Furthermore, over the last few decades, the private EMS sector has seen a series of consolidations, creating a pyramid structure where small and medium firms make up 98% of the providers, but only operate about half of the ambulances. Nationally, public health insurance account for nearly 60% of the private sector revenue, and many of these firms have exclusive operating agreements with local agencies. With such public investment, California should set a higher standard for wages and working conditions. Our research shows that the state should fortify relevant statutes with stronger labor standards for EMT and paramedics. These standards should include higher wage requirements and health and wellness provisions. We also found the need to minimize health risks to EMS workers. This includes placing time limits on posting, requiring access to adequate meal and rest breaks, and directing greater private and public sector resources towards mental health care. Finally, continuing education requirements should be revamped and protections for incumbent workers should be established when contracts change to promote the creation of long-term, well-trained EMS workforce. Turnover rates should be reported by private companies and considered by LEMSAs in granting exclusive operating contracts. The emergency medical services is both a critical healthcare and employment sector. State and local policies to improve working conditions will not only make EMT and paramedics' careers sustainable, but for thousands of current workers, but will also improve emergency medical care for all Californians. Thank you.
Thank you both for the work you have done and continue to do on behalf of the EMTs and paramedics here in the state of California. To ensure that you're able to hear directly from the folks on the ground, I want to invite Jason Brolini. Jason is an EMT himself and president of the United EMS Workers Local 4911 and a true advocate for the working class private sector EMS crews. Jason?
I'd like to take this opportunity to thank the Assemblyman and his staff for the commitment and the dedication to improving the industry that I've spent 24 years in. I had a great speech and a statement prepared. I don't think I could articulate the facts of the white paper any clearer than what you've already heard. It's unfortunate that the stresses that we have remain a constant over the last 24 years. In that 24 years, I've had 4 of my colleagues and members commit suicide as attributed to the PTSD and the post-traumatic stress and the critical incident that they've encountered in the job. I know that mental health for EMS is a very complex issue, But as we look at the financial and budgetary landscape in the state of California, and as we see budget cuts to mental health, social services for the homeless, drug and alcohol programs, we are seeing this increased violence and this increased stress. These are just a few cornerstone foundational pieces to relieve some of that stress in the hopes of preventing violent injuries from our members and our providers that provide care to your families, as well as the first steps to decreasing the amount of incidents that we have of suicide in our industry. It hurts personally to know that we have a suicide rate just below our police officers on the streets. And again, I'll make this real quick. Thank you for your dedication and your commitment, and a long-term commitment to reducing these stresses. One suicide is too much, and I can't thank you enough. Thank you.
Thank you, Jason. And as I spoken earlier, over 30 years working in the industry, and I continue to do so from time to time now that my schedule is limited, but I can advocate for everything that the research brings about and what Jason just spoke with. I can relate to all of that from one perspective to another. And with this research paper that came out, it kind of took the words out of my mouth, something I've been saying for many years of that industry. But there's a lot of work to be done. So it's time that we truly recognize the sacrifice and hard work that these folks have been doing to ensure our health system works. So with that, I'm proud to be joined by a couple of my colleagues, Assemblymember McCarty, Assemblymember Garcia, and Eloise Reyes-Gomez. If you'd like to say a few words. So with that, oh no, I'm sorry, go ahead. Go ahead, Eloise, would you like to say a few words?
I just wanted to say that I join Assemblymember Rodriguez. When we're talking about the safety of our workers, we know this is something we have to stand behind. And I applaud you for bringing this to our attention so that we can stand behind you as well in this legislation.
Certainly, I support this measure to bring equal rights for people in the force. Public safety out there is a tough job, whether it's police officers or paramedics or fighting fires. I just want to note that as a council member like you, Mr. Rodriguez and Mr. Garcia, I had the chance to go on a ride along and see the tough work. But I also know that the private sector folks, a lot of times they would try to go after and undercut this work. And how they do it? By paying lower wages, lower benefits, stressful conditions, which you heard firsthand from this white paper. So I think this bill is going to bring about fairness to the workers, but also improve public safety in our communities.
Everyone else? I'm the kind of person that says less is more, but buenos días. Estoy aquí para apoyar al asambleísta Freddie Rodríguez con su propuesta que está protegiendo a las personas que nosotros dependemos, que estén ahí para nosotros en una situación en donde nos encontramos vulnerables. Y estoy aquí orgullosamente apoyando su propuesta a las personas aquí que nos protegen y bueno, estamos dispuestos para seguir luchando, que todos tengan un salario necesario para poder al mismo tiempo cuidar a sus familias, pero más que nada nosotros dependemos de estos profesionales para que nos cuiden a nosotros y estamos aquí para apoyar la propuesta. Gracias.
Again, thank you to everyone who was able to attend today. I'm joined by my friends that asked me to help answer any questions at this moment, if anybody has any questions. If not, thank you all for being here this morning, and we'll keep you posted on how things turn out. Thank you all. Okay, thanks.